Hello everyone, you are watching BSc Nursing Karnataka YouTube channel. So in this video I am going to talking about peptic ulcer. So what is peptic ulcer? Peptic ulcer, it is nothing but there will be a lining or damaging of the stomach or mucosal layer due to the excessive pepsin and stomach acid secretion. The main cause of this peptic ulcer is H. pylori bacteria. And let's see what will happen in peptic ulcer disease condition. There will be a damage in lamina propria and submucosa. So this peptic ulcer will going to occur in a two types. First is duodenum ulcer and another is gastric ulcer. So the individual feels a pain in a stomach region and there will be a complaint of severe fever and there will be a complaint of regurgitation. So here you can see the two images, gastric and duodenal ulcer. This is the perfect images of gastric and duodenal ulcer. Let's see what is the risk factor for this peptic ulcer. The first one is here lifestyle. While you are going to smoking, there will be a excessive secretion of the stomach acid or acid content. There will be a going to secretion and there will be a reduction of the bicarbonate production. So the individual going to be develop a ulcer, and while going to drink acid drinks means you are going to drink a soda or any beverages, so there will be a chance of developing of a peptic ulcer. Severe medications like NSAIDs, non-steroidal anti-inflammatory drugs, are very responsible for this growing of a H. pylori bacteria. And another is H. pylori infection. As I mentioned, H. pylori is a very commonest thing to develop a peptic ulcer. It will be a very dangerous when it will go to the chronic condition. Commonly age about 30 to 40 age members will develop a duodenal ulcer, and over a 50 age there will be a chance for gastric ulcer. So there will be a mention gender. There are increasing in the older women or men, and due to the excessive consumption of alcohol also it will lead to a severe or chronic peptic ulcer condition. Let's see what is this pathophysiology. For defensive mechanism, the bicarbonate and mucosal layer and prostaglandin secretion and mucosal blood flow and as well as epithelial renewal, it will lead to the defensive mechanism against peptic ulcer. And aggressive, while there will be a excessive production of a acid secretion due to the H. pylori bacteria and non-steroidal anti-inflammatory drugs, and there is a excessive secretion of a pepsin and bile acids, and due to the consumption of alcohol and smoking. It is the pathophysiology of a peptic ulcer. Let's see what is the diagnostic test we want to do for detect the H. pylori bacteria. First, we will do esophagogastroduodenoscopy, commonly called as EGD. So it is a endoscopic procedure to visualize the lining, stomach lining and esophagus and upper part of the small intestine. Basically, physicians going to do the procedure to visualize the GIT tract. And another is upper gastrointestinal series. It is also a radiographic examination procedure. In this, physicians are going to examine the GIT tract. And another is urea breath test. In urea breath test, what happen? Urea going to produce the enzyme urease. That urease going to break down into ammonia and carbon dioxide. So there will be a test positive. These are the main tests to diagnose the H. pylori bacteria. Basically in clinical side, we have to do the physical examination. In that we have to assess the pain of the patient, in which region the patient is going to feel the pain. This is the first part of the peptic ulcer. I hope you guys like this video. The next video I am going to upload the clinical manifestation and the particular treatment for peptic ulcer.